President Obama, well, first of all, if you're a large employer or an employer with more than 50 employees. You're already providing health insurance. You don't have to do anything other than just make sure that you can show that you're providing health insurance. And there was a lot of news recently about how we delayed the so-called employer mandate for a year because under the law, what it says is if you have more than 50 employees, you're not providing health insurance to your employees. Then you're going to pay a penalty to help pay for the fact that we, the taxpayers, are going to have to provide your employees with health insurance, which, by the way, is only fair. A lot of the controversy around the Affordable Care Act had to do with these so-called mandates. Both an employer mandate and an individual mandate. And the employer mandate says, if you don't meet your responsibilities by your employees, and they end up getting Medicaid or they're ending up in the emergency room, you're basically dumping those costs onto society. That's not fair. So we're going to charge you a couple $1,000s to help pay for health care for those employees. To the individuals, what we said was we're going to make health insurance so affordable. So cheap for you, so heavily subsidized if you're not making a lot of money. That if you're not getting health insurance, then it's because you just decided you don't want to, you don't need to. And in that circumstance, what happens when you get hit by a bus, heaven forbid? Or somebody in your family gets sick, and you hadn't had them covered? Well, we're going to end up having to pay for you anyway because we're Not going to just let somebody bleed in front of the emergency room. So what we've said is you've got to take responsibility. And so there's a small penalty if you don't get health insurance. This is where a lot of the controversy and unpopularity came in. Because people generally don't like to be told, you've got to get health insurance. And employers don't like be told, you've got to give your employees health insurance. But, as a society, what we cannot do is to say, you have no responsibilities whatsoever, but you've got guaranteed coverage. And this raises the whole issue of pre-existing conditions. Which we haven't talked a lot about but is really important. One of the central components of this law, one of the main perversities of the healthcare system, before this law passed was there were millions of people around the country who if you had gotten sick before, if you had had a heart attack, if you had had cancer, if you had diabetes, let's say, when it first happened you had a job, you got cured, then you lose your job or you're trying to change jobs or you're trying to start a business, you try to go out and get health insurance. The health insurance company not only could deny you but had every incentive to deny you. Because, basically, they'd rather have healthy people who are paying premiums and never asking for a payout. They don't want somebody who actuarially they can anticipate might get sick. And so, keep in mind that a huge percentage of our society has some sort of pre-existing condition. And they can be locked out. You can do everything right, work hard, build a strong middle-class life. But if you've been sick and then you lose your job or something happens, you may suddenly be locked out of the insurance market. Or the premiums may be so high that only somebody fabulously rich could afford it. So what we said is, alright, you know what, insurance companies. You can no longer bar somebody from getting health insurance just because they've got a pre-existing condition. But the only way that works is if everybody had a requirement to get health insurance. Because think about what happens if you don't have that rule. Well, all of us, not all of us, but a lot of us who were trying to figure out how to save some money would say, well, I'm not going to worry about it until I get sick. And then right when I'm diagnosed with something that's going to be expensive, I'll go to the insurance company and say, you can't prevent me from getting health insurance just because I've got a pre-existing condition. So they could potentially game the system and it wouldn't work. So now what we've done is said you've got to provide health insurance to anybody, all comers. That's the deal. The flip side of it is everybody has got some responsibility. And we'll help you pay for it to get health insurance. And that's where a lot of the misunderstandings, the frustrations about healthcare reform came in. I should add, by the way, that this was the same proposition that was set up. In Massachusetts under a governor named Mitt Romney that's working really well. "99% of the people in Massachusetts have coverage. And that same principle was, ironically, considered a very smart Republican conservative principle. But it was the right one. The economics of it are true. So, just to finish up the question, when it comes to businesses, if you're already providing health insurance for your employees, that's great. You don't have to do much other than just make sure that you show us that you've got health insurance for your employees. If you have more than 50 employees, and you're not providing health insurance for them, you now have the opportunity to join a pool of small businesses to get a better price and a better deal on health insurance. You're eligible for tax credits in providing health insurance to your employees. Up to 35% of the premiums for each employee will be a tax benefit, a tax credit from the federal government. But if you still aren't providing health insurance for your employees after that, then we're going to go ahead and penalize you for it. And I can understand why some businesses wouldn't want to pay for it. If they're not currently providing health insurance for their employees. What that means is that they'd rather have those additional profits than make sure that their employees are getting a fair deal. In some cases, they may be operating under some very small margins. But keep in mind, since people or companies are exempted, the average small business with 5 employees mom and pop shop, 10 employees, they're not under that requirement. So I'm not that sympathetic to a company, typically. if it's got more than 50 employees and generating some significant revenue. We're making it affordable for them to provide health insurance for their employees. They should do the right thing. W.J. Clinton, I agree with that. But you just heard the president say that so far in virtually every state. The actual prices of the insurance are coming in quite a bit lower than they were originally estimated to. With the original price estimates and with the government obligated to provide subsidies, which costs money on the budget, right? It was, nonetheless, estimated that in the first 10 years, this would keep the national debt $110 billion. Lower than it otherwise would have been, which means if we come in at even less, we can bring the debt down more. Or we can subsidize more small businesses and get more small businesses into this loop. A lot of people come up to me and say, "Now, you sound like the people you used to." Criticize who say we could cut taxes all day long, increase spending and balance the budget. Don't give me that, this sounds too good to be true. So I think before you leave, you should tell people how we can spend more, not so much in direct spending. But in tax credits, and still wind up reducing overall federal spending by $110 billion during this decade. President Obama, well, a couple of things just in terms of how this whole thing got paid for. First of all, I think it's really important to point out here that the total cost of the Affordable Care Act to provide health insurance for every American out there at an Affordable rate is costing about the same amount over the course of 10 years as the cost of the prescription drug bill that President Bush passed, except that wasn't paid for. We felt obliged to actually pay for it and not just add to the deficit. So what we did, it's paid for by a combination of things. We did raise taxes on some things. We, for example, said that for high-end income individuals, you can pay a slightly higher Medicare rate Medicare tax. So we bumped that up a little bit. We said that for employers who are currently providing a so-called Cadillac health care plan, where there are so many bells and whistles, there's no incentive to actually spend wisely when it comes to health care. We're actually going to penalize you for that, not only to raise a little bit of money. But also to say you're encouraging the worst aspects of a health. Care system where you spend a lot of money, you don't get better outcomes. I mentioned to you Medicare. We basically said there's a program in Medicare called Medicare Advantage that provides some additional options for Medicare recipients above and beyond standard Medicare. And it's very popular with a lot of seniors. You get eyeglasses and other benefits. But it turned out that it was so uncompetitive that we were providing tens of billions of dollars of subsidies to the insurance companies under this Medicare. Advantage plan without getting better outcomes, health outcomes for seniors.